It has been 7 days since my patient's central line dressing has been changed, so I will now proceed with that process. First, I will check the orders as well as the facility policy. Next, I will gather my supplies, which includes the central line dressing kit, a Bioderm patch, as well as saline flushes, the needleless connector ports, and protective cap. Now I am ready to head over to my patient's room. Alright.
We can't do anything in blue.
Hello, Mr. Jones. How are you? I am Mindy, your nurse, and I'm just here to change your central line dressing since it hasn't been changed in 7 days. Are you ready for that? Alright, awesome. Now, I will perform hand hygiene, and I will don gloves.
So no dots. And you're going to write everything you did while you were here. Okay? Everything you practiced goes on that line. Okay. And then, depending on your instructor, some of the instructors don't want you to add up your times. They do it, but I don't know what Ms. Walton has told you. And then this is where we sign. That is what you have done.
Mr. Jones, as always, can you please tell me your name and date of birth?
Go over in that corner and you
Thank you so much.
and you come to me to
I just need to check
blah, blah, blah.
your wristbands.
You got to come to one of us and say, I'm going to be practicing over there.
Alright.
We'll watch you.
And
We'll
now
see you.
I will provide
Needs to be something
for
that's
patient
checked off.
privacy.
We certainly have to be right there with you.
And I will assist the patient
More than one
to a comfortable position.
But I don't want you to
The head of the
come here
bed
with
no
all
more
this
than 30 degrees,
stuff.
and I also raise the bed to a working height.
And we'll hesitate to sign.
Alright.
Okay?
Now,
So just
I
make
will
sure
expose
somebody's
the
aware of
patient.
what you're doing. Alright? So you want
And
to do sterile gloving? Okay.
I will start to
Right here.
open my package, maintaining sterility. Grab my mask,
So when you leave, we're actually
and I will place it onto the patient.
So it's okay, you don't have to worry about adding that. Actually, you do, because for contact tracing, just in case.
If the patient couldn't wear a mask for whatever reason, I would just ask them to turn their head away from the site. And I will also place a mask on myself if needed. Alright, now it is time to remove the dressing. I will remove the dressing with a stretching motion and also while lifting, ensuring that the catheter doesn't move out of place. Alright, and I will also remove the bio patch and discard.
So top and bottom.
Okay, now I will observe the site, assess for any signs of infection or inflammation, and I will note that when I go to document. Now I am ready to remove my gloves.
Now your fingers go in that cup.
Just for demonstration. And I will perform hand hygiene.
Give it a little snap and it won't fold back.
Now,
You're holding it wrong.
I will take my sterile gloves
Just watch your fingers so you don't touch this glove.
and I will don my sterile
Just give
gloves.
it a little snap. Okay, good. This is what I don't want you to do. Because if it does fold back on you, you have that 1 inch. But if this
Alright.
part touches, contaminated,
Okay.
press start again.
And now I will
Jan, you're gonna go on first.
take my chlorohexidine. I will snap the
Whatever
mechanism.
you feel more comfortable with. They say
This is my non-sterile hand. My non-dominant hand is my left hand. My sterile hand is my right hand. I will use this hand to maneuver the catheter so that I can clean thoroughly.
okay, so this glove,
I will clean in a hashtag motion
this part,
for 30 seconds.
this hand, you cannot touch. You can't contaminate that one. This you can touch.
At
That's
least
what
30
it is.
seconds in a hashtag motion. Alright, now that I'm done, I will discard my chlorohexidine. Alright, and now I will use my sterile hand to gather my gauze that will be used to dry the site. I use my non-sterile hand to maneuver the catheter.
And if your
Alright,
fingers don't go in the
and now I
hole,
will
you can
discard.
Fix it when you put your other one. Okay?
Okay, now I'm ready to get my bio patch.
Yeah.
I will take it out of its sterile packaging
This is where you're going. You see that's the top.
and I will
not the top, just the hem. You can pick that whole glove up, because your hand is sterile and so is the glove.
Sterile hand.
And just be aware,
Maneuver the catheter
quality
and
gloves,
place
so
it.
when you're in the hospital, it will be easier to take them out of the package.
Okay,
You
now
can do
I'm
it
ready
here, you
to
can.
attach the dressing.
Now, the main thing with this is this.
I will
This
remove
says,
the
"I'm gonna help
adhesive.
you," but it's gonna touch something and contaminate itself. So get that thumb out of the way.
And now I will place it
That's why we have
onto
thumbs.
the
They
dressing.
do help, but they don't when we're
onto
doing
the catheter, I mean.
Good, good. Very good. Now what do you do? Thanks very much. Nothing below the waist and in front of you. And your size is good. If you're sterile gloves, you wanna make sure. The clean gloves don't really make that
And
much difference.
I will
They should
remove-
take you like a second scan, okay? Because when you're doing it for sterile procedures, you're gonna
I will remove this outer covering.
What's your last name? Give your
I'm saving the sticker for dating. First, I will write down the date and the time, and I will add it to the dressing. Discarding. All right.
Okay. Ready?
Okay. And now I am ready to perform the central line care. So first, I will prepare the sterile alcohol pad. Place it in here. Now I will open up my connector, needleless connector port from the package
What size glove did you
while maintaining its sterility. Attach a saline flush.
Very good.
It's in the wrong
Good to
direction,
go.
but
What's your last
you know what I
name?
mean.
Ready?
I will attach the saline flush. And
The
now
other thing is when you make a correction on any medical,
I will
any document, no scribbling, no.
remove
One line through and
the
your
old
initials.
connector,
The person who's looking at that should be able to read
and I will
what your error
open a
was,
saline pad.
okay? So that they know that you haven't corrected something or added. If you go to court
I'll
in
scrub
10
it
or 12
with
years,
alcohol
you're not gonna
for
remember
10
all that.
seconds at least.
So, let's hope that never happens to any of
6,
these guys.
8,
So one
9,
line through
10.
and your initials.
I will discard it, and I will attach
You can write
the
error
new
if you want,
connector,
okay?
and I will flush using a push-pause method in which 1 milliliter is briskly put in, and then there is a slight pause, and then that will continue for the whole 10 milliliters of the flush. Then I will disconnect my flush and apply a protective cap. I will repeat the same procedure for all ports that are unused. Okay? And now I am ready to cover the patient back up. And now I am going to lower the bed to the lowest position. Okay, and now I can discard my trash. And now I can discard my gloves. Now perform hand hygiene. And I will ask, Mr. Jones, is there anything else that you need today? No, I'm fine, thank you. Alright. Alright, you have a nice day. And now I will document that the central line dressing was changed. I will also note any assessment findings that I saw on the patient's skin, and I will note how each port was flushed.